Good morning. Just me this morning, and it is me. So, good morning and thank you for being here. 92.1% of Victorians have now had a first dose of COVID-19 vaccine, and 77.5% have had their second dose. Yesterday, 21,272 vaccines were administered across our state system. 746 people are in hospital with COVID-19, which is stable. 137 of those people are in intensive care, with 85 of those being on ventilators. Very sadly, 25 Victorians have lost their lives from COVID-19 that we are reporting today. And they include a man in his 40s, a man and a woman in their 50s, 2 men in their 60s, 4 men and 2 women in their 70s, 6 men and 4 women in their 80s, and 4 women in their 90s. So it's going to be a really difficult time for the family and friends of those 25 Victorians, and we pass our deepest condolences to their loved ones in these challenging times. There were 82,648 tests processed yesterday, which is another really strong number, and thanks to Victorians for coming forward to be tested when they have symptoms of COVID-19. And there were 1,923 cases recorded of coronavirus, all locally acquired, bringing us to a total of 22,189 active cases in Victoria. So to talk a little bit about some of the top-line trends, again, we have a slightly higher number, it being a Thursday, which has been the consistent trend for over a month now. But for the first time in 3 weeks, our Thursday figure is just under 2,000, which is good to see. Casey, again, has the highest number of cases for any of our local government areas, with 193 new cases. Did also want to mention Glen Eira in the southeast, which had 57 new cases yesterday, which is a significant uptick on what we've seen previously in that area. Turning to regional Victoria, there were 38 new cases reported in Wodonga, and we know that testing demand has been very high in Albury-Wodonga, and thank everyone in that community for coming forward. We are sending up more testing resources this weekend, more test kits and more teams to assist with demand. And we have been working closely with New South Wales Health, who are also providing support to the border area there, of course. Also regionally, 33 new cases in Latrobe and 31 new cases in Shepparton. Turning to thunderstorm asthma, which is something we've spoken about previously in these conferences, we have put out an alert today for a high risk of epidemic thunderstorm asthma in the western parts of our state. So Mallee, Southwest and Wimmera weather districts. And we know that our hospitals are already experiencing significant demand on their services, including their emergency services from COVID-19. So if you live in one of these areas and have asthma or hay fever, really important that you proactively manage any symptoms to keep yourself as well as possible. So you can protect yourself by monitoring the risk forecast and heeding any advice or warnings on the Vic Emergency app. Important to avoid being outdoors during a storm or high winds, or indeed the wind gusts in the lead up to storm activity. Take your preventative medications as directed and carry your puffer or your reliever with you today if you do have asthma. Important time to revisit your asthma management plans and to consult your GP if you have any questions at all. Of course, if your condition does deteriorate, don't hesitate to call 000 or attend hospital. And I did also want to speak about the Australian Immunisation Register, or AIR exemption process for COVID-19 vaccination. So, as we've again discussed previously, a very small number of people are unable to get COVID-19 vaccination because they have a condition or a situation where the condition is medically unadvised or contraindicated. We must remember that most people who are legitimately in this position actually really would love to get vaccinated. And the rest of us getting vaccinated helps protect those who can't. Our hardworking, fantastic Victorian GPs are, in large part, tasked with determining these exemptions when visited by their patients. But we have heard feedback from some of our GP colleagues that there have been some problems with this process. This feedback has really been around the need for more clarity on this process, more information on the limited medical exemptions as advised by ATAGI, or the Australian Technical Advisory Group on Immunisation, and a way of communicating these exemptions so that they can work with their patients through this process. Some GPs have faced or reportedly faced quite significant pressure from some people who don't want to get the vaccine for other reasons beyond those limited exemptions. And we have heard of reports of people travelling from clinic to clinic seeking those exemptions. That's why we will be making a change to the Chief Health Officer directions from 6 p.m. tomorrow. That's when the change is made, that only the Australian Immunisation Register medical exemption form is to be used to provide patients proof of medical exemption to any vaccination requirements in Victoria. Then patients will be able to access their AIR medical exemption certificate via the MyGov website, in the same way they can access their vaccination certificates. And this can then be used anywhere that proof of vaccination is required. For those who don't have a smartphone able to do that, medical practitioners can print out this certificate for their use. This change will additionally be supported by guidance from the vaccination program here in Victoria to clinicians, and a particular form that will be available to be able to be used as a resource by those GPs. This guidance form will assist them in determining whether their patient meets the ATAGI listed exemptions or the reasons for a medical exemption. So for people who currently have an exemption letter that is not the Australian Immunisation Register form, such as a standard letter or certificate from their GP, they will need to return to their medical practitioner so that the AIR form can be submitted, and this will need to occur by the 12th of November. Up until that date, they can continue to use their doctor's certificate or letter as they are now. And the Victorian guidance form presents the limited contraindications to vaccination very clearly to help our GP colleagues in these consultations with their patients. It also includes having COVID-19. So if someone's been diagnosed with COVID-19 in the previous 6 months as a reason for a temporary exemption, if the individual has not recovered from acute illness. So to clarify, for someone who has had documented COVID-19 infection, that they can be issued a temporary exemption from vaccination for up to 6 months following that infection. So we feel the combination of the Victorian guidance form and the Commonwealth's medical exemption form will provide GPs with a really tight and clear process that they can work through with their patients. And while it is an added step for people with genuine medical reasons that they can't receive COVID-19 vaccination, going through the Australian Immunisation Register and getting a digital certificate through MyGov is really a much more practical way for them to live and work as we all move into the vaccinated economy. It will also mean that those who don't have any of those specific contraindications to vaccination will see their exemptions, their existing exemptions, expire in a fortnight's time. One of the best features of the vaccination rollout in Victoria has been our ongoing, really close partnership with general practice, pharmacies, and other primary care settings. And we've worked together to navigate what's been, for all of us, a very difficult year, and to provide each other with support. And this is no different. So in closing, I do want to thank Victoria's GPs for putting our community on the path to being one of the most vaccinated societies worldwide. And I'll stop there and invite any questions. Thank you.
25 deaths seems a lot. Were they all in the, can you clarify that they were all reported in the past 24 hours? And were they specific to, and I know we can't go into too much detail, but are they specific to a facility or is it spread across?
No, there is a broad spread. To answer the first part of your question, it is indeed the case that they were all reported yesterday. There was one person who had passed away, I think a week and a half ago, that was a delayed report. But all of the other people who lost their lives, actually the date of their passing was in the 3 days prior to that reporting. So all but one are people who have lost their lives in the 3 days in the lead up to yesterday, which is really, really sad. And I think we've reflected previously that as we see the case numbers increase in the community, that is to be followed 10 to 14 days later by people who have ended up in hospital and some of whom lose their lives. And so this is the consequence of those case numbers, and in many ways it's a much more significant number for us to reflect on. But it is very sad, and it's a big number.
And then do you have an understanding of how many percentage of those who passed away were vaccinated or unvaccinated?
Yeah, so those data are available, but we're not going to be reporting on that. I will come back though. What I can state is if we look at people in the last week who have been vaccinated, amongst the cases in general, this is not amongst people who lost their lives, I think 85% of those who were notified with COVID-19 in the last 7 days, 85% were not fully vaccinated. And again, if we look across the outbreak and think about, again, the more serious end of the sort of spectrum of COVID infections, I think for hospitals, 69% of people who ended up in hospital were unvaccinated, completely unvaccinated, compared with 98% being eligible. And for intensive care, 80% were completely unvaccinated, no doses. So it's very clear the impact of vaccination on serious illness and loss of life.
And then just with the 1,900 or so cases today,
yes,
I know it's gone up, but it's certainly not the sort of spike, not being an epidemiologist, but I was expecting over 2,000. So what did you think when you saw those numbers?
So the first thing I thought was I was happy it wasn't above 2,000. Look, it's still a large number, as you say. It's still over 1,900 Victorians who have been diagnosed with a serious health condition, and our thoughts are with them. I think this is a result of what the Victorian community is achieving, which is, despite the fact that we are continuing to open up and get some of those freedoms back, which we've all missed so much, the absolutely amazing efforts of Victoria to get vaccinated. And we've just at the start of this press conference reflected, over 90% of people over the age of 16 and closely coming up on 80% having their second dose. This is what we will see. We will see the case numbers start to come down, but critically, the hospitalisation and the fact that our hospital numbers remain stable at 750 or so. This is testament to the impact of vaccines on case numbers, but especially on hospitalisation.
Just talking about hospitals, how well placed are they to cope with possibly an influx of patients today from the thunderstorm asthma event?
Yeah. So look, it's an important point. our system is under pressure from COVID, no question. We've seen particularly our emergency services, Ambulance Victoria, emergency departments, really serving the needs of so many Victorians, and obviously that puts pressure on the system. We have been through thunderstorm asthma before. There's a lot of protocols in place on how to surge. It is the case that with the overlapping symptoms, so shortness of breath or someone who's presenting in a breathless way, that has to be considered as being potentially COVID associated, not just asthma associated. So our system stands ready, and indeed we do have reserve capacity, but our clinicians are under pressure and have been with the COVID pandemic. You're absolutely right. Just come back to the point, people who know that they have asthma or have a history of hay fever, they can be really proactive right now, particularly in those western parts of Victoria, to try and manage their own asthma so that they don't end up having to go to hospital. But if they are significantly short of breath or concerned, then clearly our emergency system stands by to help.
But is there that capacity in these regions where there's the most severe risk in terms of the weather event today?
Yeah, so certainly there's additional capacity being stood up. There's plans in place for surge events around thunderstorm asthma. So those are, yes, absolutely in place. There is capacity, but we would like to limit that capacity to the people who really, really need it, which is why, again, speaking to your GP, activating your asthma management plan and ensuring that you're using your preventers is really important.
Can you describe how serious this risk is for anyone who may experience the asthma event today?
Yeah, so certainly in those western parts of Victoria, and that's where the sort of the higher level alert is, but there's not zero risk in the central parts of the state either. So I would say to anybody, any Victorian living with asthma, be really aware of your symptoms today, keep up with your preventers and do all of those preventive work. So, sorry, the core of your question was?
Just describing how severe the risk is, not
Yeah.
only exposed for asthma and hay fever sufferers, but I suppose people who don't typically experience those.
Yeah, no, and that is entirely possible, that someone who has not previously had a significant asthma attack could potentially, this could be their first episode, which is very scary if it happens. And just to reiterate, if someone is feeling significantly short of breath and is in that situation, they should call 000 or attend hospital. So no, it is a high risk in the western parts of Victoria today. We anticipate there will be some presentations with asthma, including amongst people who have not had it before. There are resources on our website about thunderstorm asthma, so people can review those, go through the sort of symptoms that might occur. But essentially, if someone, particularly if they're at rest and short of breath, that's an emergency situation and they need medical attention, whether that's an ambulance or attending their local general practitioner, seeking, and also important for the rest of us to support people in that situation and help them to access the care they need.
There'll be a few people taking off tomorrow, obviously, because we can enter the regions again. The Chief Commissioner of Police has said they probably won't be policing an early exodus on the roads. Are you concerned that that's going to, I guess, add to the load on the regional caseload, or is it when people get to the regions that really, does it really make any difference?
Oh, look, I'd encourage everyone to be safe on their travel, as well as not just from COVID perspectives, but obviously, it's exciting that the state's being reunited, if you like, and people can visit their friends and family or just go for a well-deserved break in regional Victoria. But obviously, I would share the Chief Commissioner's concerns that people do so safely, that people plan their trip, and that we don't see sort of, what is potentially going to be significant crowding on the roads translate into, accidents and people being injured. So that's the first part. I totally understand the concerns of some regional Victorians that, they're already seeing a relative uptick in COVID cases in many parts of Victoria. I would say that regional Victoria has shown amazing capacity to deal with COVID over the last 2 years. We've seen outbreaks in many settings where the communities really come together to support their health system. We're seeing it happen with educational settings right now. I would also reflect on the fact that I believe Victoria's vaccination levels for our regional areas is the highest in the country. If you look across Australia and look at the vaccination uptake for regional areas, Victoria is on top. And so that again is testament to regional Victoria actually doing this in the safest possible way. But both socially and economically, this is a really important moment for many people in the regions as well.
In terms of case numbers, during looking like we're stabilising, and is that what you're expecting to happen around now, looking at the modelling and then kind of forecasting forward? Are you still expecting another spike in December, kind of as described by Burnett?
Yeah. So yes, a simple answer is it was previously heralded that we may see a stabilisation in numbers in the last week of October into the first week of November. So it does appear, based on not just the case numbers, but looking at the effective R value, etc., that is occurring in Victoria at the moment. Notwithstanding that, we've got, as I've said previously, these sort of competing forces. We've got increased opening up and mixing of people, which is necessary and part of us getting back to this as normal a life as possible. At the same time, we've got very, very high vaccination levels and increasing every day. So there are, at this sort of point where we are probably reaching a plateau, there's going to be a bit of churn around that. You know, days will look different to up and down over the course of the next couple of weeks. The modelling suggests that then we might see a slight reduction in case numbers, followed by, as you say, a subsequent rise again through December and January. Exactly how that plays out, to what degree it just becomes a relative plateau, and then how high that subsequent peak is subject to all of us and our vaccination levels. The more people who get vaccinated, the lower that next peak will be, and even more importantly, the lower the subsequent peak in hospital presentations and people ending up in ICU will be. So it's in all of our hands to encourage those of us who haven't embarked on that vaccination journey as yet to do so, because that's how we can affect what happens with that peak.
On vaccination exemption certificates, is the change designed to stop GPs doing the wrong thing if they have been?
It's exactly the opposite. It's designed to support GPs, many of whom are my close friends and colleagues. And look, whilst most Victorians have been amazing about this, there have been some people who, according to reports from some of our GP colleagues, have really put a lot of pressure to be given an exemption in circumstances where they don't meet the quite specific criteria as per the ATAGI recommendations. So this is about, I guess, resourcing GPs. So they've got something from the government to say, these are the indications not to be vaccinated, and if you don't meet these indications, then you can't be issued a vaccination certificate. So it's much more about supporting GPs in their conversations with their patients rather than seeking to control behaviour of any of our GP colleagues.
I didn't mean to suggest in the question that there was
That's
a
okay.
flag of GPs doing the wrong thing.
No.
There are peak lobby groups that said they had concerns about reports from their own people.
Sure.
About a very small number having no exemptions when they shouldn't have been had.
Yeah, sure. No, I wasn't trying to criticise you, but you know, for every report I see of someone, a clinical colleague potentially not doing the right thing, I have hundreds of colleagues reporting back how hard it is when they're faced with the small minority of Victorians who are seeking exemptions for reasons other than the medical exemptions that have been supported by ATAGI and that are sort of included in the AIR form. So this really is about supporting them.
Can you just clarify better, so it's two forms that will need to be filled out?
So there's one form, the actual form, the Australian Immunisation Register form. The other is a Victorian government clinical guidance. So basically, in parallel with that form, it's essentially some of our GP colleagues have fed back having something to very clearly have printed up in front of the patient so they can work through and show, if you don't have this contraindication, if you don't have that medical issue, then I can't give you an exemption. It's really that degree of support that they need.
Is that available for the public to view somewhere, or?
Yes, absolutely. It'll be available, and if it's not there already, it'll be on our website soon. I mean, there's a lot of clinical resources, both on our own website and through partner agencies that are involved in the immunisation program. But yeah, I think as widely available as possible for that form is really important, so we all are playing off the same information.
When you talk about pressure, was it a case that GPs were reporting that they felt threatened by certain patients?
No, I wouldn't say threatened, but I would say that there have been reports of people going from general practice to try and get different outcomes. We also, and look, notwithstanding anything else, GPs are under huge pressure looking after people. The last thing we want is for a lot of consultations to be booked just to work through the same thing over and over again with a different GP. So hopefully this makes that process really, really clear, and allows us to sort of move forward into the vaccinated economy, bringing as many people along as we can, because ultimately this is not about trying to control people's behaviour, it's about keeping everybody safe so we can open up without the sort of pressure on our health system and the tragic loss of life that we do see happening.
How quickly would you like to see a vaccine made available to children under 12 years old?
So I think the clinical trials and the assessment of that process, not just from a safety and efficacy point of view, but the contribution to the safety of those children, but also that sort of altruistic benefit to the rest of the community, that's all still very much be worked through. I would like to see the evidence as quickly as possible so that those decisions can be made. But I think the focus, certainly that of the vaccination program, is that we are charging through all of the currently eligible vaccinated or vaccinatable individuals in Victoria at a huge rate, and I'd love to see that continue. In the meantime, totally acknowledging that we do see significant case numbers amongst young people. I think a third of our cases in the last 24 hours were under the age of 19. So whatever evidence comes to the fore, that will be used to make decisions around that vaccination. I think it's an important consideration.
If it's given the tip of approval, given the number of cases we have seen in childcare centres and schools, would you like to see a no jab, no play, or no child?
Yeah, I think before any such sort of policy or recommendations, I should say, public health recommendations for those sort of policies, we would need to see the evidence, the sort of balance of risk and benefit, but critically also what contribution it will make at the point in time where it becomes available, because that could be quite different in 3 months, 6 months to what it is right now.
And what's the advice for people who've been infected with COVID and that's the reason they're not vaccinated yet? Do they have to wait 6 months?
They
to
do
get
not.
vaccinated? Can they get vaccinated at any time?
So essentially the recommendation for someone who has had proven COVID-19, like documented PCR, so swab positive COVID, is they should not have vaccination, including a scheduled dose of vaccination, if they still have symptoms of the acute infection. So they should wait till they're completely recovered from the acute infection before they go ahead and have vaccination. After that, there is no safety concern with getting vaccinated once they're fully recovered, even if that's only a matter of weeks afterwards. Recommendations as to how long it can be deferred vary. Once you're out at 6 months after a course of infection, we are concerned that the risk of breakthrough infections and loss of immunity starts to become significant, which is why that sort of expiry date on that temporary exemption is set at 6 months, or has been recommended to be set at 6 months. But certainly if someone has documented COVID infection and completely recovers, even if it's only sort of a couple of months down the track, they're eligible for vaccination, it's safe to do so.
The PM says that aged care residents and health workers will be the priority now that a target is ticked off on the Pfizer booster. Is that the right course of action as far as you're concerned, the right, priority?
Yeah, so absolutely. I think for a couple of reasons. Firstly, because aged care residents, frontline aged care workers and frontline healthcare workers were amongst the first people to be vaccinated in Australia under the phase 1A of the rollout. So they're the ones who, on average, were vaccinated more than 6 months ago, and for some of those people, substantially longer than that. Secondly, it's a question of consequence. So ensuring that those who are most at risk of severe outcomes, because we know from the studies coming out of Israel, for instance, that not only does a booster protect against infection, documented infection, it also protects against serious infection. We are seeing cases in aged care facilities in Victoria at the moment, both amongst workers and amongst residents. And so completely agree that a top priority for the booster program is aged care workers, frontline healthcare workers, but yes, absolutely aged care residents who are more than 6 months from their second dose.
One of the early rollout groups in the original rollout was, people working at points of entry as well.
Indeed.
Stuff. Do they need to be included in this initial rollout, or is that kind of for those reasons not
Yeah, so the ATAGI recommendations are essentially for, population-wide eligibility beyond 6 months. And so you're absolutely right. And we were very clear from the very start of the vaccination program in Victoria that all people working in hotel quarantine had to be completely vaccinated. So they tend to be amongst the very first vaccinated. So yes, eligible. I guess in terms of the potential consequences of infection, now that we have established transmission here in our community, the relative contribution of further incursions from overseas through quarantine programs is a totally different story to what it would have been 3 or 4 months ago standing up and talking to you about it, because no longer are we really trying to prevent those single incursions, although we obviously seek to do so, because we have established transmission in the community. And so whilst those workers have done a huge amount for our community and have kept us safe for so long, yes, they should be eligible, yes, they should be prioritised, but potentially aged care workers and residents are really the front line that we need to protect most right now.
Last question.
I'm not sure if you've spoken on this before, but do you have a rough estimate of how many Victorians are genuinely eligible for a vaccine exemption?
Look, I don't know the number. It is very small. If we think about the medical contraindications for instance, the mRNA vaccine, so the Pfizer vaccine and the Moderna vaccine, it's really anaphylaxis from a previous dose or from known anaphylaxis from an ingredient in those vaccines, or a history of some particular sort of cardiac inflammation following a first dose from those vaccines. So very, very limited indeed, and indeed limited to people who have already had their first dose. For AstraZeneca, previous anaphylaxis or a severe allergic reaction. In addition to that, there are those rare conditions which we believe may be associated with a slightly increased risk of that rare but serious clotting condition, TTS, which was reported in association to AstraZeneca. So people with a history of particular type of clotting in the brain or in the abdomen, or a particular allergy to a blood thinning agent called heparin. So we're really talking about small numbers of people here.
Is there any idea about how many people will kind of be stripped of their eligibility?
No. Look, that there may well be some information on that. I guess part of the reason it's difficult to know that clearly is with the current system, it may be just a letter from their GP that they're holding. So that's not something that's stored anywhere, which is part of the reason the advantage of this is that we'll be able to, it's very privately held. It's not like that, someone's status will be sort of declared when they check in that it's someone who's exempt for medical reasons. All it comes up is saying that they've got a valid certificate under the vaccination program. So we don't know how many people have gone through other mechanisms such as a letter from their GP. I suspect that there will be a small but significant number of people who will be frustrated by this. The flip side is that we are trying to ensure that not only are the people who have valid exemptions able to participate in the vaccinated economy, so that they're not, they're for their own medical reasons excluded from venues, etc. But the more people who are vaccinated, the safer people who can't be vaccinated. So whether it's young children, whether it's people who do have these exemptions, the more of us who get vaccinated, the safer they are, alongside the safer the rest of the community is.
Maybe a question for the government, but do you know how much longer our mass state hubs will be in place for? Will they be used throughout the booster rollout? What's the plan?
Yeah, no, I will have to defer to my programmatic colleagues and to the government regarding those plans. Okay, thank you. Thanks so much.